familiar paragraph to commence the meeting. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's June 16th, 2021 revised order extending remote participation by all members in any meeting of a public body, this meeting of the Great Barrington Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at townofgb.org. For this meeting, members of the public who wish to listen to the meeting may do so in the following manner. See instructions at the top of the agenda. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. With that being said, I will call the meeting officially to order with a roll call vote. Peter Stanton.
Here.
Ruby Chang.
Here.
And I am here as well. Assuming you've all looked at the minutes from July, I'll look for a motion to approve.
I make a motion to approve the minutes from July.
I second.
And I am in agreement. First order of business tonight is any updates on the Housatonic Waterworks issue. This is a recurring agenda item. Is there anything new, Rebecca? I know the select board has heard their first report and they're going to be hearing another. But in terms of our sphere, is there anything new?
So we have not heard any complaints since our last Board of Health meeting in the health department from any residents. And I just want to extend the offer, the invite to always do that with the health department if you have any concerns or you're experiencing brown water or any other sort of public health issue in terms of Housatonic Waterworks or the fire district company, whatever. We're always open to hearing those in the health department, as well as bringing them to the Board of Health. But we have not heard any in the last month. I don't know that no news means good news in this circumstance. But I will say that we have actually seen an increase in people coming to the health department to receive water testing kits. I think we've given out more this summer than we ordinarily have. And I don't know that those are all residents of Housatonic or customers of Housatonic Waterworks who are concerned about their water, or if it's that we've had an abundance of rain in the last couple months, well, couple weeks really. And anytime you see that, bacteria is of a greater concern. So we talk about that, come to the health department to get testing kits. So I just wanted to let you guys know that that messaging has finally worked, or it seemed as though it has in July. But no, Michael, you covered my update in terms of the Housatonic Waterworks assessment that the select board has authorized and seen at least one of two presentations on, and then the second one will be Monday, August 9th at 6 p.m. And then this second presentation will cover, I think, capital assessment. And
Okay.
And then beyond Monday, August 9th, preliminarily, the town manager has said that he's going to talk to the select board about having a future meeting specific to this topic to talk about next steps. Okay, we've heard these presentations. What do we do from here? So I think that's next beyond Monday, August 9th. And then our last meeting, the Board of Health asked me to reach out to DEP to ask when we can expect a response from them in regards to the engineer engineering assessment or proposal submitted by Housatonic Waterworks Company to address manganese. And I'm still awaiting a response from Deirdre Doherty about when we can hear a response on their approval or denial or what have you of that engineered proposal.
Okay. Well, I'm wondering, and it seems to me that perhaps it's time to discontinue this as a recurring agenda item and instead have it be one that is put on our agenda when we actually have something concrete to discuss that's within our purview or ideally within our jurisdiction, but certainly now that the select board has really taken this matter and they've had the information, or at least going through the information that they've commissioned, it seems to me that we can respond in kind if they ask us for input. And once we see both reports, if we certainly want to take it up, but I wonder if the utility of having this as a recurring agenda item has been reached, and now it's time to have it be as needed. Do you guys have any thoughts on that, Ruby or Peter?
It makes sense to me.
Yeah, I agree as well. I think that at this point, the select board has taken over. I mean, I just want to keep this fresh until we really get to where the select board is really kind of looking at it seriously. And I think if we have anything new or people have complaints, we can certainly bring it back up.
Yeah. Okay. So I think we'll do that, Rebecca. I know we talked about that a little bit, so sounds like we're in agreement to do that.
Before you move on, there's a hand raised.
Oh, yes. Eileen, I see your hand raised. Do you have a question?
Yes, you were going to ask whether the health board could pay to have the free kits tested so people wouldn't have expense. And I wondered whether you had a response on that.
I don't at this point.
You know,
Thank
I didn't ask, so thank you for reminding me. Are we talking about testing for lead and copper, or just?
I think it was to cover testing in general from residents.
That's what I understood also.
Okay. My guess, I'll have to ask, but I feel we don't have the money in our budget this fiscal year to do that. I don't know if it's somewhere else within the town budget as a whole, but we absolutely did not budget for that this fiscal year.
So the short answer, Eileen, is not at this time, but we can look further than our budget since it's just not in there.
I'm writing that down so I don't forget a second time.
Okay. Did you say you wanted to mention? Oh, that was before we moved on. Okay, well, I think that covers it for the Housatonic Waterworks. So we can move on to health department updates. And I see we can start with inspection updates and then talk about the glyphosate moratorium.
Ned, did you want to weigh in on anything on the health department report or in regards to inspections? Was there anything I'm going to cover the foodborne illness outbreaks later on, but beyond that, is there any other inspection anomalies that we saw this month?
Sorry, no, I didn't have anything out of the ordinary to mention. Everyone seems to be doing well downtown. The businesses have been picking up, and we'll just see what happens going forward with that, with the masks and everything. I really don't have anything else to add.
All right, thank you. But otherwise, just business as normal. We've been chugging along with Title V inspections and perk tests. They're actually those two types of inspections have actually been lower in July than they were in the spring. So nothing out of the ordinary there.
Okay. Does that cover it for inspection updates?
Yes.
Okay. So where are we with our glyphosate moratorium endeavor?
Okay, so this is an agenda item. I just clarified there was some confusion on whether or not we were going to vote on that tonight, and that is not the plan. And I would not advise the Board of Health to vote on anything in regards to glyphosate tonight, since I specifically told people that we were not. But I did want to provide an update on just what the health department has accomplished in the last month. So thanks to Nan Weil, who has provided the health department with a lot of research and a lot of documentation from other Massachusetts towns and cities who've passed sort of regulations or policies or similar moratoriums as to what we're thinking. I have a pretty good idea of how I was able to draft something based on what other towns have done. It's not complete, so I can't present it to you today. I'm still waiting to hear on whether or not town council should weigh in on this. The main question I have is how it would be enforceable. I really don't see enforcement being a huge issue with this temporary policy, over the course of a year, seeing as we're specifically, we have jurisdiction only over town-owned property. So that's my one remaining question for hopefully town council to get back to us on. But next steps, I'm thinking that we should vote on a policy, a moratorium to temporarily ban the use of glyphosate containing products, if that's the way you choose to go, within a public hearing. Of course, if that's not a requirement, boards of health can pass any policies or regulations other than Title V regulations just in a normal meeting setting. But since there's so much public interest in this topic, and I do not want to leave anyone uninformed or without an opportunity to speak on this issue, my suggestion would be to hold this vote within a public hearing. So that would give me the chance to present our facts of finding. That would give the Board of Health to discuss, and then obviously the public a chance to speak. So that's my recommendation, and I think that we could plan on that for October, because our next meeting, September, I would like to invite or extend an invite to some of the pertaining boards and commissions that have jurisdiction on town-owned property. So I'm thinking the Cemetery Commission, the Conservation Commission, maybe the Select Board, as well as the Highway Superintendent, and then the Department of Public Works Director, who oversees all town buildings and grounds. So I've said before that in unofficial conversations with the Department of Public Works, their general practice is to not use glyphosate or Roundup or any sort of spraying of glyphosate. In the one circumstance that they did use glyphosate containing herbicides was for a problem invasive, and then they hired, I believe, wildlife restoration, to a licensed applicator to address that specific site. But anyway, I think that it would be a good idea to just, like I said, extend the invite, whether or not each representative comes to a Board of Health meeting, or they just submit a letter saying that they're in favor or these are their concerns. I think that we should do that at our next September meeting.
Sure.
And the other thing I wanted to add was, at our last meeting, I think it was Eileen had asked that some information go up on the health department website. And while we did get a tab up there in July, it says, I don't have it up, it says glyphosate, cancer-causing herbicide, something like that. I did finish editing a document today with science and other literature documenting, reasons why the Board of Health is considering this sort of policy. That's all I have.
Okay. Well, I know, and I think it was almost 2 years ago now that we spoke with at least one member of the Conservation Commission. And the commission right now is down a couple members, so I think, and it's been some time, so I think it's good to reach out to them, as well as the other commissions who this will impact. And if they want to just submit a letter, that's fine. I think that should be an option. They don't necessarily have to attend, but or if they want to comment anyway, I think that would be good. My only thing I know I mentioned before is our moratorium should have some language for, it seems that the Conservation Commission deals with invasives and their management. And I would like for there to be some mechanism, should there be some sort of issue that comes up in the next year where it wasn't locked out, if that commission deemed it necessary to combat something that became a real problem. So I don't know what that language will look like or sound like, but I would like to, I mean, it's almost like some sort of variance arm where if it were deemed, I don't necessarily anticipate that happening, but you could never say never. And I know there are opinions on both sides of that.
So in the working draft that I have now, there is a bullet point with language specific to variance requests. So draft says now, glyphosate containing herbicides it would be allowed or would be permitted via a variance approved by the Board of Health. Requests have to come in by writing, in writing, and my intention would be that we would review it as a board, maybe with the applicant present, and so basically there would be provisions to allow for a variance, or that's what I have in my draft.
Right.
And then you would see them as case by case.
Right. I mean, my impression from being on my short time on the Conservation Commission is they don't rush to do that. It's kind of a tool of last resort, but certainly is a tool. And
Right.
I know the whole point of this is to try to send a signal and discourage its use. But I think there's a case to be made for the threat of invasives, and they can get out of control. And I wouldn't say that it's ideal, but I wouldn't want to rule it out completely. So I'm glad there's some language in there. And I'm sure at a public hearing, we can hear more about that. I know Sari Hoy's here tonight, and she's talked at our meetings before. If you wanted to make any comment, Sari, you'd be welcome to tonight, but that's kind of where we're at. You've been our most persistent person weighing in on the other side. So
Yeah.
I just want to extend that offer to you.
Well, thank you. And obviously it is of interest to me because we do specialize in invasive species control, and our goal is to take care of the environment. And so to lose the tool that we think is one of the least detrimental to the environment would be a real challenge on how to manage invasives in places that they need to be managed. So I like the idea that you have some sort of way to, you know, look at each individual site and make a decision on a one-on-one basis. So, I mean, we're used to coming through the Concom in every town for this type of thing. So coming through the Board of Health would be, I'm assuming, a similar sort of process. So that's really, to me, as long as there's a way for Great Barrington to deal with invasives when they need to, that I think that's good. I'd also like the opportunity to submit maybe some other kind of documents for you to review on glyphosate. Thank you. So I will try and get a few things together, as up to date as possible. I don't have them at my fingertips, but I'll see what I can do. And obviously, there's a little time to do that and give you time to read them too. So thank you for that opportunity too.
Sure. Yeah, well, we'll look forward to any comments we're going to make in the public hearing as well. So I'm sure we'll have. Great.
Thank you.
Yep. Thank you. Okay.
You know what? I didn't write these 2 additional things down, so pardon me for forgetting about them. But I did want to clarify that I misunderstood. Berkshire Hills Regional School District is not a town-owned, a Great Barrington-owned property, or where the schools, that's not managed by the town. So we can't. Well, we are partial owners. If you want to look at it that way, you know, we can't make decisions that would affect the entire district. So we're just eliminating the Berkshire Hills School District from the property list that I think I had gone over with you before.
Okay. So what? Just for a thumbnail sketch, it's obviously town hall, parks, cemeteries.
If you give me 30 seconds, I can pull up the list for you. My list does not include town-owned cemeteries, though.
How many of those are there?
I'm not sure.
Oh.
The Mason Library, Ransdell Library, the Fire Department, Police Station, Claire Teak Senior Center, Town Hall, Campus, and Park. And then parks would include South Street Park, Memorial Field, Grove Street Park, Olympia Meadows, Lake Mansfield Beach and Park, Parish Park, Charles Castronova Park, which is the GB Bush, Dewey Park, McAllister Reserve, Housatonic Village Commons Playground, Housatonic Community Center, the Hoosie Dome, and Old Maids Park. So about 21 locations plus the town cemeteries. I forgot to add them on this list. So.
Okay. All right, well, that's good. We'll look forward to the next couple of meetings and getting to a public hearing and finally getting something on the books for this issue. Anything else under department updates?
A few things if we're done with this topic.
I think so, unless there's any other comments out there about it. Okay, what do you got?
Okay, just a brief update on 232 Stockbridge Road. Since our last meeting, I've asked town council to dismiss our housing court complaint, so that's since been dismissed. And I also wanted to give an update on the July Maven report that we got from our newest public health nurse. So this is sans COVID. We'll be talking about that under our next agenda item, but there were other things going on in July besides COVID, and I think that they are worth sharing. So I'm just going to go over confirmed cases that I saw on that report. So we had 2 confirmed cases of anaplasmosis in July. 3 confirmed cases of babiosis. And so those are tick-borne diseases. And then we had 1 confirmed case of cryptosporidiosis. And technically at the end of June, but DPH contacted us in the beginning of July to trace and follow up on these diseases. But we had 1 confirmed case of Vibrio. I might be pronouncing that wrong. And then 2 confirmed cases of cyclosporiasis. I might need Ruby to help me pronounce that. But both of those 3 confirmed cases are all foodborne illnesses. So the Vibrio was traced back to oysters, and I'm not sure that we ever identified a source for the cyclosporiasis. But we were working with a food establishment in town to kind of figure out what those patrons bought and purchased. So that was interesting. So if there are no questions, I'll go on to the next update I had.
Yes, please.
Okay. So I just wanted to encourage the Board of Health, as well as any attendees, to start advertising our Code Red emergency system. I sent out an email to food establishment, lodging establishments, and camps last week, 2 weeks ago, asking all of our businesses that we have jurisdiction over to sign up for this townwide emergency alert system. It's really the best way to stay informed in terms of what's happening in town. I'm sure some people might be hesitant, but they think they're going to get spam messages, or just their phone will be constantly going off. But the town is very discerning on what sort of messaging goes out through the Code Red system. And, in light of the boil water order that affected all of the fire district customers at the end of July, it pointed to a glaring just miscommunication problem that the health department has with getting information out to folks that need it. So I don't want to make that mistake, and I want everyone to stay informed as we hear about these things. So that's just my announcement to get everyone signed up for Code Red.
One quick question, since you mentioned that the boil water update. What was the timeline on it? I mean, I remember getting calls towards the end of that week. And what's the procedure for something like that? I mean, what's the mechanism? They obviously, a test comes back to the flag goes up when a test registers a certain level, and then what happens from there? Does the fire district notify their customers, or are we responsible for that? Or
so that's a good question. So the timeline was that on Friday, I think it was July 23rd, DEP conducts regular testing of public water supplies. And so the raw water sample, one of the raw water samples collected, had come back with high bacteria counts, E. coli. So the raw water sample is pre-treatment, that's not the end product that comes through your tap. But still, out of an abundance of caution, it's their policy to issue these boil water orders on the whole public water supply. So all customers would get this, or would be under this boil water order, until additional samples can come back free and clear of high amounts of bacteria. So yes, since the fire district is their own company, the onus is on them to communicate with their customers. But because it's a situation that affects our residents, we want to get that information out there too. And sometimes the town and the health department is better equipped at communicating with town businesses like restaurants, grocery stores, lodging establishments to get this information. So it's a collaborative approach, and we do this for Housatonic Waterworks, and we want to work collaboratively. But then, so samples went to the lab, and I think on the next day, Saturday the 24th, we learned that the samples came back free and clear. Maybe it was a testing error. Maybe it was just one of the samples had a lot of bacteria. I'm not really sure why it originally came back with high bacteria, but the next resamples were free and clear. But the boil water order wasn't lifted until Sunday, the 25th. So it was very brief but inconvenient weekend for downtown.
So it was issued on a Friday and then lifted on the Sunday.
Right.
Okay. And was there any reports of anyone who got sick or anything like that?
Nope, not in our Maven reporting system.
I know two people who live over on East Street, and they claim that they were sickened earlier in the week with what they said was from the water. So whether it was or not, that's kind of what prompted me to ask.
Mm.
Anyhow, it could be
I didn't see any reports coming in through Maven that were traced back to that. But of course, things slip through the cracks all the time. It's only that someone goes to seek treatment or medical care that it would then get into our disease reporting system. So
I was just curious if anyone in follow up to the boil order had called in and issued any comments or complaints. So okay, that's good. Thank you. That answers my question. Anything else under the health department updates?
no, thank you.
Okay. Well, let's move on to community COVID-19 and our department, our update on that issue.
So I had planned a totally different synopsis when I posted this agenda of where Great Barrington is, but in 2 days' time, more information has come, and the situation is a lot different than I had hoped in our community and in Berkshire County in terms of COVID and possibly the Delta variant. So let me just go over July numbers first before we start talking about this first week in August and where it's left us right now. But throughout July, we had 10 reported cases. 5 reported cases were in the 0 to 11 age range. And I'm just going to go with the higher brackets here. So 5 were within 0 to 11. And then 30 to 39, we had 8 reported cases. And then the third highest was 4 reported cases in the age range of 40 to 49. And if, we're obviously concerned about our elder population, but the 60 to 70 age range only saw 3 confirmed cases. So that's a big age group. So I think that's a pretty low number, but still. So that's where we were in July. Still very low numbers. This week alone, August 1st through the 4th, we've had 10 reported cases. So in all of Berkshire County, we're seeing elevated levels of coronavirus. I don't have any hospital data to share with you this week. We didn't get our normal weekly update from BHS, and I've just started communicating with Heather Barberi from Fairview Hospital to get regular updates, since now it seems like we're entering into a different sort of situation. So on that note, we've decided to reinstate our town COVID calls. We had been meeting weekly with the town manager, a representative from Fairview Hospital, EMS, and a select board member or two, and some the senior center, and just various others. And we had stopped those calls in April, I think, because the pandemic was in kind of like, you know, a secure place, and we didn't feel as though we had any regular updates to share with one another. But now that numbers are kind of spiking, I think it's probably a good time to start communicating as a group again. So I will be getting regular updates, hopefully, from Fairview Hospital and BHS. So, and then also our new public health nurse pointed out that this last week on the CDC's data mapping, Berkshire County as a whole jumped from moderate to, sorry, 1 second, let me pull it up here. From moderate to substantial transmission, its transmission level. And so along with that rating, their recommendation for counties within that rating is to adhere to stricter masking guidance. So what I was going to say when I had planned for this discussion was that as of July 30th, the Massachusetts Department of Public Health had revised their mask advisory to be in adherence with the CDC mask guidance, which I can read to you now if you'd like. That fully vaccinated persons or unvaccinated persons, of course, wear masks or face coverings when indoors or when other risk factors may be present. Other risk factors could include if you have a weakened immune system, if you are at increased risk for severe disease because of your age or underlying medical condition, or if someone in your household has a weakened immune system or is at increased risk for severe disease or is unvaccinated. So that's the Massachusetts Department of Public Health's mask recommendation, which again is in alignment with the CDC's mask advisory. So all of this is to say is I'm wondering if the Board of Health would consider passing a Board of Health Public Health, a Great Barrington Board of Health Public Health advisory to be in alignment with the CDC's recommendation for indoor masking, regardless of vaccination status in public settings. And just to add to that further, while Great Barrington is not all of Berkshire County, of course, we are a hub of South County. We do have a higher number of restaurants and food establishments and retail stores than most other South County towns. And I think you would all agree that this is definitely a hub for visitors. And while our population might only be 7,000, give or take year round, it's likely higher than that now that we're in our summer season. So we have a lot of people coming and going. Tourism, eating, shopping. And so I just want you to consider making some sort of public health advisory now that we've been identified as a substantial transmission, or we've been identified as having substantial transmission as a county.
In that county-wide classification, is there any indication if we're seeing elevated risk because of congregate care facilities? I know that's happened in the past where you have a few facilities that pushes the numbers up. Do we have any indication if that is occurring? If that's accounting for the new classification, or is it an and or both?
That is a very good question, and it very well could be. This last week, there was an outbreak in a nursing home somewhere in North County, and I don't know numbers. I don't know what the congregate care facility was, and regardless, but it could be what's driving the CDC data up as a county as if they're looking at it as a county, us as a county as a whole. But I think it is an and or type of situation, because as I started off saying, just in this last week alone, we have seen 10 confirmed cases, whereas all throughout July we had 14. And I think, so does that answer your question?
It does, yep. I mean, I know we talked about this a little bit earlier today, and having thought about it, I think it makes sense to err on the side of caution when we can, and I think since the most we can do is issue an advisory, I'm in favor of doing that. I think some of the reporting that's starting to emerge is showing a less clear picture on vaccine efficacy in terms of spread, and so especially if considering we do have an older population, I think it would make sense to do that. My feelings that our community would probably respond well to that. I can't say for visitors to hear, but I think certainly it seems like it would be a welcome thing for certain people, and perhaps it would make easier for businesses to ask or put in place policies that will keep a sense of I don't want to say calm, but feeling like we're doing something, and that's as much as we can do. So I would be in favor of issuing advisory, and then we're in alignment as well. I think we've always looked to the state as the state looks to the CDC. So I think that would be appropriate, but that's just my feeling. And how do you guys feel about it, Ruby and Peter?
I'm just in shock because I saw 3 cases today in my office. So it was just this afternoon. And one of the teenagers, well, 2 of the teenagers had never even thought of getting a vaccine. They just didn't think about it. It was not in their radar. One of the teenager actually works in local restaurants. I have asked many patients of mine who are bussing the tables in many restaurants, and I asked them, do they wear their mask? And they said they were told not to. So they're indoors, vaccinated. However, they're serving people who may not be vaccinated, which doesn't really matter anymore, because at this point, we know whether you're vaccinated or not vaccinated, you're still at risk of catching it and giving it. And which we all knew from previous experiences with all different kinds of vaccines, that nothing is 100%. But this variant is very infectious, and I really feel that we need to really jump ahead. I mean, I think we need to look at the town, how can we protect the people that are serving, that are providing support for all the businesses, and protect them and back them up to say that they need protection. All the people that are working housekeeping, all the people that are working the jobs that are essential workers, and making sure that they're getting protected. So I strongly agree that this cannot come at a more timely manner to make sure that we are doing what we can as a town. As you all know, it's very crowded. When I was coming back, I was a little late because it was very crowded in downtown with a car show, and most people crowded together were not masked. So that just frightens me. When you see the kids are sick, and they're pretty sick, it makes you wonder, like, what are we doing here? you know, it's the kids that I see anyway. But the essential workers, we need to absolutely protect them. And the only way we can protect them is to make sure we have a mandate so the people they work for understand the mandate so that that will follow through.
So just to be specific, I think all we can do is an advisory at this point. Or is that, am I misspeaking on that?
Yeah,
Well, you know, the US CDC, their latest masking guidance indicate that calling for people, even those who are vaccinated, to wear a mask indoor public settings in areas which transmission is categorized as high or substantial is in direct response to the Delta variant. And that is from the data that's recently received because of breakthrough cases. So, you know, these are CDC mask guidance, and I think that we can also add our guidance. We can't, obviously, there's no way we could kind of like go in and check and fine or anything like that. But I think having a stronger guidance for our town is really important.
Right, I just wanted to be clear that we due to there not being a state of emergency, we can't mandate it.
No, but it's a strong guidance, I think, which goes along with the CDC.
Sure. So go ahead.
I just wanted to support the language that Rebecca had suggested.
And so what would our specific language be, Rebecca?
I don't know if you can do this, but I could read something and then Peter could motion to approve it and then second and vote and so forth. I think we can do it that way.
I think that's fine. If you have a suggested language, we can always
Okay.
modify it as we see fit.
Right. Hold on one second. Okay. So the Great Barrington Board of Health passes a public health advisory stating the CDC has recently categorized Berkshire County as having a substantial level of community transmission in this last week, ending August 3rd. While Great Barrington cases still remain low, the Delta variant is proving to be rapidly spreading, and Great Barrington has a higher than state average of elder residents. In order to keep our community safe, we are recommending that all residents, visitors, employees, and employers wear a mask while indoors, regardless of vaccination status. Should you have any questions or concerns, please follow up with the Great Barrington Health Department or come to our next Board of Health meeting. Does that sound sufficient?
There is,
Go ahead.
I was just gonna say, maybe a sentence or two back, you could just add in line with the CDC recommendations.
Yes.
And could we say more than just could we say strongly suggest instead of just, would that be more, do you feel that more appropriate, Ruby, to add that word?
Right, and I was just looking and I was wondering if you had mentioned regardless of the person's vaccine status, because I think that people are still with the understanding if I'm vaccinated, I don't need masking. I mean, that's the message that has been given to people for quite a long time. And now we're saying something, so it's very confusing. So that must mean people who are not vaccinated, but it's regardless of your vaccine status, everyone needs to be vaccinated, masked indoors.
Yeah, it does say that in your wording, Rebecca, regardless of vaccination status.
Yes, it does. I'll read you that sentence again.
Okay.
And let me try revising it here on the spot. In alignment with the CDC's recommendations, and in order to keep our community safe, we are strongly recommending that all residents, visitors, employees, and employers wear a mask while indoors. I'm going to add in public settings, regardless of vaccination status.
Great.
Okay, that will be the key piece of the advisory. But again, just to reiterate, I will be sending that out if you vote on this through a code red notification, sending it out to our email lists, putting it up on the town's website, and I think we have several media reporters in attendance tonight who will help us out with that too. So,
Can I offer one more slight edit?
yes.
At the beginning of that sentence, you have "in order to keep our community safe."
Sorry?
You have, at the beginning of that sentence that you just read, you have the phrase "in order to keep our community safe."
Yes.
And I think it might be a little more specific to say in the effort to keep our community safe.
Excellent.
If you guys don't have any problem with that,
No, that's great.
that way we can emphasize that this is done with the best of intentions. Well, I'm good with that language, and if you guys are, then
I have a question. I'm sorry to complicate the discussion, but I guess I just wonder if you want to keep the piece the CDC has recently categorized Berkshire County as a substantial level of community transmission in the last week in or out of this public health advisory. Because if we change ratings,
yeah.
I don't know that we'll want to change our public health advisory every week.
I think that's a good point. I think perhaps we should take that out of there because, I mean, if it changed next week, I don't think it would make sense to just, lift this advisory or go back to our earlier advisory that we put out. I'd rather keep something like this for a month or two until things are headed consistently in a certain direction.
I had read just as we're talking that 87% of the counties are rated with this new category. So we certainly aren't alone in this.
But it might be better to address it monthly at our Board of Health meetings as whether or not we want to change our advisory, keep it the same, as opposed to a on week by week basis as the CDC updates their
I do think it's good to have people understand that we have evidence that there is increased risk. Because I think that really gives people the understanding we're not just pulling straws out of the sky or whatever. This is we have issues, and I don't know if you want to add the increased test positives that we've had recently as part of this conversation, just so people are aware that we are seeing rising cases.
I think, well, let me throw out this idea. What about adding more information to our website? I'm fully aware that our website is clunky and is hard to use and not the most user-friendly, I should say. I'm used to it. I don't think it's hard to use, and maybe folks are on a spectrum of that. But right now, it's the best we have, and I just wonder if you think that putting up some sort of weekly or monthly, I hesitate to say weekly because things change, but maybe a monthly synopsis of where Great Barrington is and numbered. So obviously we have to be highly sensitive to HIPAA and, you know, medical.
Can we just do that at our next our monthly meeting? Maybe that will make it simpler. Since we already already had this as an agenda item, then we can certainly address that probably with more specificity at a meeting and with the sensitivity that we need. And I think, I see your point about the language, but I think we just leave it in there. And if next month, after we've had 4 weeks of data and reporting, if we want to amend the advisory and change the language, then we can. But maybe I think for the sake of simplicity, and since it's certainly accurate information, and I see, and I acknowledge Ruby's point that this is, I think it's fine to leave it in there. Yeah, so do you want to read one more time what we have, and then it can be motioned and we can vote on it, unless anyone has any other input. I think it's good what we have.
Would you like me to read it one more time?
Yeah, and then someone can just motion that language, then we can all be on the same page.
Okay. The Great Barrington Board of Health is issuing a public health advisory in light of the CDC's recent categorizations of Berkshire County as having a substantial level of community transmission. While Great Barrington cases remain low, the Delta variant is proving to be rapidly spreading, and Great Barrington has a higher than state average of elder residents. In alignment with the CDC's recommendation and in the effort to keep our community safe, we are strongly recommending that all residents, visitors, employers, and employees wear a mask while indoors in public settings, regardless of vaccination status. Should you have any questions or concerns, please follow up with the Great Barrington Health Department or come to our next Board of Health meeting.
That sounds good. Do I have a motion for that language?
How do we want that motion to be worded? For what reason?
For what reason, or just, I think we can just adopt the aforementioned language as a
Which is going to be distributed to the businesses in town.
I think it'll just go out to the public or general, or I think it's for everyone.
The general public health advisory, yes.
Make a
But we'll
motion
start, go ahead.
I make a motion to approve the language for public distribution.
I second.
And I'm in agreement. And so we'll post that. I'm sure it will be, or how will it be disseminated other than posting it and sending it out to businesses?
Well, I'll send out, the advisory through our email groups that we have, our email chains that we have with certain businesses like our food establishments, lodging establishments. It'll be on the town website. We'll issue a code red about it. I've also utilized the Chamber of Commerce to help get public health information out to businesses. So hopefully they'll help with that. And like I said, hopefully some media that are in attendance tonight can help us disseminating too.
Okay. Great. If there's nothing more on that, we can move on to the last few points on our agenda. I see Eileen's hand up. Go ahead, Eileen.
Oh, I think you need a roll call vote.
Oh, you're correct. Yes, we do. Yes, we do.
And Rebecca, if you send it to me tonight, like right after the meeting, I can get it out right away.
Thank you.
Okay, so on the aforementioned advisory to the public in Great Barrington, Peter Stanton?
Aye.
Yu Chang,
I,
and I vote aye as well. Good. Thank you for reminding that, Eileen. I always forget that for some reason. If there's nothing more on that bullet point, we can just move on to our Board of Health questions and updates. It sounds like we've covered everything. I don't have anything further, any questions? Do you two? Do either of you, Peter or Ruby?
Oh,
no.
So last point, is any questions from the media?
I have a question.
Go ahead.
Do all of you have your shots?
I'm not sure we should answer that question.
Yes, I would tend to plead the fifth on that.
All right.
Any other questions? I know we usually have a bullet point for general questions from the public. So if there's anyone still in attendance who has any questions, now's your time. I see one. Nan, go ahead.
Nan, you're on mute if you're trying to share a comment. We still can't hear you.
I see your hand, but your screen is dark and you're on mute. So maybe the hand is up accidentally.
We could go on and see if she comes back.
Yes, we'll cycle back to you if you're having technical difficulties. Is there anyone else who has any questions?
I think I just want to make a clarification for Eileen.
Mhm.
That I personally, and I'm assuming the Board of Health as well, highly encourage people to be vaccinated, but just on principle for individual, I guess, privacy. It seemed like it wasn't a good question to answer.
Yes, I would concur with the privacy
Okay.
issue.
Thank you.
Yep.
Eileen, did you have a question about the vaccine that I could help you with?
No,
Okay.
thank you.
This is Sari. Nan, actually her mouse died and so she can't unmute her
Oh, no.
sound. I just told her to call me and we'll do it through the phone, but
Hey, Rebecca, can you unmute her or is that something she?
no. Oh, can you? Yeah.
I can ask all to unmute, but I still think you have to click on it.
Yeah, I think that in the beginning there was some potential there, but I don't think they allow you to do that anymore.
Okay.
She says it's not urgent, so.
Is there a chat? I don't see it.
Chat function.
Oh, yeah.
But
No,
if the mouse died, I don't think you can get to it.
yeah, she says it can wait till September.
Okay. All right, very good. Thanks,
All right.
thanks, Nan.
Yeah.
Any other questions or comments about anything we've talked about tonight before we adjourn for the evening?
I think we're all good.
Well, not seeing anything. I think we can call the meeting adjourned, and I do believe we have to do that, the roll call vote as well. So we'll call the meeting adjourned. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well. Great. Thank you, everyone. Thank you, Rebecca.
Thank you.